Hello everyone, Fixxxer here. I've got a video for you that you probably did not expect on my channel at all. It's a personal matter, and I don't normally discuss private or personal things on my channel in any way, shape, or form. But today I am, and judging by the title, you could probably figure out what's going on. I want to talk about lupus because I have lupus, and generally speaking, people just don't know what it is. In fact, in a recent survey, 80% of Americans said that they have heard of lupus, but they have no clue what it is. So, that's what I am here to do. I want to talk about it because I'd like you to know exactly what it is, do my small part in educating 10 of you, or whoever watches this video, on what it is, and I want to do it in a way that won't be any kind of pity party. I don't want that. I just want people to know what it is and understand what it is, and that's it, and that's what I'm here to do. So to give you a brief summary of what I'll be discussing here, I'll be discussing what is lupus and what lupus is not, who gets it, what causes it, and what are the symptoms of lupus, and what are my symptoms specifically, and what it takes to get a diagnosis for lupus. I'll also be going over how lupus is treated and what life is like living with lupus. So what is it? Well, in short, it's a chronic autoimmune disease that can be pretty hard to define. Your immune system produces antibodies to fight off foreign agents such as viruses and bacteria, right? Well, autoimmunity is when your system is unable to differentiate your own tissue from that of a foreign invader, and it will attack it. Think of it more along the lines of friendly fire. My immune system is pretty kick-ass when it goes out to fight things, so much so that it just gets a little trigger-happy and starts attacking things that it should not be attacking. So, depending on who you ask, there are 3 or 4 different main types of lupus. There are several different categories, but 3 or 4 main types of lupus. Discoid lupus is about 10% of all cases, which involves rashes and lesions on the skin. It focuses on the skin. A famous case of this would be Seal, the singer. If you remember, his face has some lesions on it. That is discoid lupus. Another 10% of people have just drug-induced lupus, which is a temporary form of lupus. And there are a few dozen drugs out there that will cause that. And a very small percentage is neonatal lupus, which is lupus passed on to a baby from their mother. And finally, there is systemic lupus erythematosus, which accounts for 70% of diagnoses of lupus, and it is the most dangerous form of lupus, and this is the type of lupus that I have, otherwise known as SLE, systemic lupus erythematosus. Now, what is lupus not? Because there is not a whole lot of awareness for lupus, it does get confused with some things. First is cancer. Because lupus deals with abnormal cells, it can get confused with cancer, especially considering that lupus can be treated with chemotherapy. The lupus cells are not malignant. They don't have any kind of rapid growth. They don't spread. They are not cancer. Lupus is not cancer. Lupus is also not HIV or AIDS. And yeah, they do get confused by some people. With AIDS being immune deficiency and lupus being autoimmune, they get kind of confused as the same thing from time to time, when in fact they are really just the opposite. With AIDS you have the weakened immune system, and with lupus you have the heightened, the excited immune system that loves to attack everything and anything that's around it. So they are not the same thing. And thirdly, lupus is not contagious in any way. You cannot give lupus to anybody. You cannot contract it from anybody. It just doesn't work that way. You can pass down genes from yourself to your children, and they can pass down genes to their children. And infants, newborns, can pick up antibodies from mothers while they're in the womb. But lupus is not contagious via blood contact, sexually transmission, none of that. It just doesn't work that way. It is not contagious in any way. Who gets lupus? Well, 5 million people worldwide have lupus, and about 1.5 million of them are Americans. Females make up 90% of the diagnoses of lupus, and that's mostly between the ages of 15 and 44 when they receive that. And it is 2 to 3 times more prevalent among people of color than Caucasians. So as a white male myself, I am in an extreme minority of those who are diagnosed with lupus. But obviously it does happen, and nobody is excluded from getting lupus. So what causes lupus? Well, it's currently unknown exactly what causes it, but it is widely accepted that it is a combination of genetics, environmental influences, and hormones. As far as genetics go, you do have certain genes that have links to lupus. I've had my DNA mapped, and they have identified some 150 genes that have ties to lupus, and those genes are passed down from generation to generation. Quite often, people with lupus will have family members that have other autoimmune diseases, and not just lupus. We're talking fibromyalgia, MS, or diabetes, and various other autoimmune diseases. So genetics is one important factor. Environmental influences is another important factor. Your immune system does most of its development in the first couple years of your life, and what it's exposed to can help shape its future. For me personally, I had the Brazilian flu when I was an infant, and I was in the hospital for quite a while. I was quite sick, and I almost died. And it's possible that helped shape my immune system for what I have today. And lastly, the hormonal factor. This comes into play mostly with women with their menstruation and the changes that their immune system goes through during menstruation. And this is widely believed that has a heavy influence on lupus in women. So how is lupus treated then? Well, there is no cure. As far as drugs go, in 2011, Benlysta became the first drug approved by the FDA to treat lupus since 1955. In fact, it is the only drug that's been approved that was developed specifically to treat lupus. It cost $28,000 for the first year of treatment, and it's shown only marginal improvements in patients. In fact, it failed phase 2 of its lupus trials. It was more successful in other autoimmune diseases. It wasn't even tested on people with severe cases of SLE, mostly just slight to moderate. So, because there's essentially no drugs that treat lupus itself, doctors have to focus on treating the symptoms of lupus. And people with lupus average 8 prescription medications to manage all their symptoms. And the primary symptoms, the inflammation, can be treated with NSAIDs, so things like ibuprofen, on a very low level, of course. And on a higher level, things like corticosteroids like prednisone will help with inflammation. And the most common drug, an antimalarial known as Plaquenil, which is what I take, that is used to treat inflammation. And again, it's an antimalarial that just happens to work fairly decently on lupus. And of course, immune suppressants are also used in fighting lupus in order to weaken the immune system. Specifically, chemotherapy is used in some more severe cases. It weakens the immune system, and therefore you have fewer antibodies out and about, killing off your tissue. Alright, so let's move on to symptoms. Lupus is often called the great imitator due to the wide variety of symptoms it can produce. Remember, the immune system produces antibodies that will attack any tissue in your body. It can attack anything at all. It can produce just about any symptom imaginable. And because of this, no two diagnoses are alike. One person can have so many different symptoms, and another person can have a completely different set of symptoms. And of course, they could have similar symptoms as well. And also because of this, there are quite a few misdiagnoses of many other illnesses. It can imitate just about anything out there. For me personally, it was originally diagnosed as gout and rosacea. And just about everybody with lupus has their own story out on what they've been misdiagnosed with. It is the great imitator. Alright, so let's talk about specific symptoms. And I'll just start with symptoms that I have, and I'll tell you which ones are common, which ones are perhaps not so common. And then I'll go into other symptoms that I do not have that tend to be common with people with lupus. Alright, so you have inflammation, which is pretty much the main symptom of lupus, right? You're producing antibodies, it's attacking your tissue, you have arthritis, your joints are swelling. Everything is really revolving around inflammation. And generally, people get this joint pain in their toes, mainly their big toe. They get it in their fingers, and again, mainly the thumb. But you can also get it in your wrists. And I'm telling you, it's not like a sprain or it's not like a carpal tunnel. This is a pain so severe that you can't hold a mouse. Of course, it doesn't always get that severe, but during a good flare-up, it can get that severe. You just can't do anything with that hand. You can't zip up your fly even. It hurts that much. But it also happens in the knees, and it can happen in the shoulders. In fact, right now I have a flare-up in my shoulders. I can't raise my arms above my head. It's just too much inflammation, too much pain to do that. But there are more serious kinds of inflammation. When inflammation happens to vital organs, and specifically the lungs and the hearts, and I've been affected by both of these. I've had pleurisy many times in my life, and pleurisy is the inflammation of the protective membrane that's around your lungs. They're called pleural layers, and they get inflamed and they rub against each other, and they rub against your lungs. And when that happens, it's severe pain when you breathe in. And the pain can get even worse when you take in deeper breaths. But it doesn't take much for those those layers to rub against each other and cause severe pain. I've been through a lot in my life, and I would rank pleurisy as probably one of the top 3 most painful things I've ever been involved with. Moving on to the heart, I have left ventricular hypertrophy by 40%, meaning my left ventricle is 40% larger than it should be due to inflammation. Obviously, this is not a small problem. When you hear about young athletes in their teens or even early 20s dropping dead of cardiac arrest on the football field or on the basketball court, this is usually due to left ventricular hypertrophy. It happens a lot in young athletes. And I'm not saying that I'm a young athlete, because I'm far from that. But just to give you an idea of what it is, if you remember Reggie Lewis of the Boston Celtics, who actually dropped dead on the basketball court during a practice, I think it was, and there's video of him on probably, I don't know if they'll put it on YouTube or Live Leak or whatever. If you see him running and he just drops dead right on the spot, and that was due to inflammation in his heart. Another common symptom is chronic fatigue. When people hear chronic fatigue, I don't really think that they realize what it is. I mean, you hear it and you're like, okay, so you're tired all the time. And of course that's true to a point, but that doesn't catch the gist of it at all. Chronic fatigue is more severe than that. It's like, I don't know if you've ever had mono, and the feeling that you get during mono or even after mono, that severe fatigue. Or if you've worked out all day, you did manual labor, you worked on the garden all day, and you're just completely dead tired. Or when you have the flu, if you feel completely useless as the flu, you lay in bed, you can't even get up to go to the bathroom. That's what chronic fatigue is. And the difference is that you feel it all the time. This is not something that you feel sometimes and not others. Of course, I mean, lupus can go into remission for people, but when it's not in remission, it is chronic fatigue all day, every day, for weeks and months, for a long time. Alright, so let's move on to sleep issues. People with lupus tend to have plenty of different types of sleep issues. For me personally, I have sleep apnea. It's when your airway closes up while you're sleeping, preventing you from breathing. I actually used to have insomnia, which is a term everybody is familiar with, but I no longer have that. In fact, I went the other way around, and I now have hypersomnia, where it doesn't matter how much sleep I get, I never feel that refreshed feeling when I wake up. I don't enter that REM sleep. I don't dream. I can get 5 hours of sleep. I can get 8 hours of sleep. I feel equally awful when I wake up. When I wake up, I feel like I need to sleep again. I don't get that refreshed feeling at all. And when you combine hypersomnia with chronic fatigue, it's like a 1-2 punch right in the face. There's not a whole lot you can do. You just have to accept it and move on. Perhaps one of the most frustrating symptoms is something called the lupus fog or brain fog. This can sometimes be identified as lesions on the brain via MRI or EEG. And this can affect you in many different ways. All types of memory loss, loss of focus, loss of concentration. And these are the issues that I tend to have. But it can get worse than that. It can lead to things like psychosis and other neurological issues. And when you have issues like memory loss and loss of focus and concentration, it affects your everyday life. It affects your home life. It affects your work life. It affects everything. And it is outrageously frustrating. And sticking with the neuro theme, inflammation does tend to cause blood clots. And blood clotting is a normal process, but inflammation obviously will cause more clotting than is needed. And because of this, strokes and TIAs are fairly common in people with lupus. I have not had a stroke myself, but I have had a TIA. I woke up in the middle of the night one day, and I couldn't feel my tongue, the left side of parts of my body. It wasn't a full-blown stroke. It was a TIA, which is usually known as a mini stroke. Photosensitivity is another pretty common symptom for people with lupus, and this involves sensitivity to light, and especially ultraviolet light, ultraviolet B and ultraviolet A. These rays go into your skin and they damage cells. When you tan, that is your skin getting damaged and protecting itself from further damage. That's your body, that's your skin telling you that something's wrong, you can't be in the sun. That is damaging your body. And when that happens, lupus goes in there, the antibodies go in there like, I got this shit. And they just start killing things. They start killing cells. It is one of the most common triggers for lupus flares is ultraviolet light. So people with lupus have to stay out of it. You gotta stay out of it. You have to wear sunblock. You have to wear clothing to prevent light from hitting your skin. That's why I usually see people with lupus wearing all that clothing and wearing hats and whatnot. When I talked to my dermatologist, she told me that the amount of time that I spend walking from my car, let's say in a parking lot, to the grocery store, to the front doors, so that's what, 1 or 2 minutes? That amount of time is too much time to spend in the sun. If I do plan to do that, I have to wear some sort of sunblock. And we're not talking cheap sunblock either. Of course, I don't always listen to my doctors, and I don't always do that. But that's what you're supposed to do. You gotta limit your exposure to sunlight, or it's going to trigger some pretty awful flares in you. Alright, let's move on to photophobia. This isn't as common as photosensitivity, and I know what you're saying, I'm not afraid of light. What do you mean photophobia? Photophobia is actually sensitivity with the eyes to sunlight. My eyes just can't take it, especially the ultraviolet light. It hurts my eyes, it causes headaches. I can feel the sun draining me as I'm in it. And because of that, I tend to operate in the dark. At home, I usually have the lights out. At work, I work in an office with the lights out. I can't be in the light. My skin can't take it, and my eyes can't take it. One of the more visual symptoms that are common with lupus is the malar rash. And that's the rash you see over the bridge of the nose, and then it branches out over the cheeks. And it's known as the lupus rash, or the malar rash, or the butterfly rash, and it got its name from because it looks like a butterfly. And even lupus itself, there's a little bit of argument on where the term lupus originated from. Some people say that it's because the rash on the face looks like a wolf bite, that a wolf bit the nose, and that's where the name lupus came from, because lupus is Latin for wolf. Others have said that it's not because of the bite, but because the rash looks like the patch of fur on a wolf's nose. I don't know if any of these are actually true, but that's generally what people have accepted. So the lupus rash, the malar rash, is usually a good sign of a flare-up. If you see somebody who has the rash, they're probably having some other severe symptoms at that time. And the rash is a good indication that it's about to go bad. Alright, let's move on to the digestive tract. There's a lot of inflammation that can happen with the esophagus that can cause things like acid reflux. I've been diagnosed with GERD myself, that's gastroesophageal reflux disease, where the esophagus, where the body produces a lot of acid that splashes up into the esophagus, and the esophagus gets irritated and inflamed. In fact, when I was 19 years old, I had a surgery called Nissen fundoplication that took my stomach and stretched it and wrapped it around my esophagus to help close off the sphincter between the esophagus and the stomach and prevent acid from splashing up into it. And a swollen, an inflamed esophagus is not a good thing. You need that to stay open so your food can go down there. I once had it so bad when I was 19, my esophagus closed up completely. I was eating dinner with my family, and I took a swallow of some chicken, I think it was, and it wouldn't go down at all. It got stuck in my esophagus, and I had to go to the hospital, and they couldn't remove it for a day. And I tell you what, you don't realize how much saliva you produce until you're not able to swallow it. And I know that's kind of disgusting, but it's true. If you can't swallow your saliva, you're going to be spitting into a bucket, and it's disgusting. Alright, so let's move on to symptoms that I do not have, but are perhaps fairly common in lupus. First and foremost is that lupus is a kidney and liver killer. It goes after these two organs more than just about any other. I've been fortunate enough to not have that problem, but quite often people don't realize they have lupus until it's kind of too late and it's already attacked and done damage to the kidneys. This contributes to the statistic that about 10% of people with lupus die within 10 years of diagnosis. It's because their kidneys or their liver fails. Again, I haven't had that problem myself. I've had kidney problems. I've had kidney stones, and I'm telling you, that is not a fun thing to have, but my body has not attacked my kidneys. Sjogren's syndrome is a common disease tied to lupus. Not everybody with lupus has it, but a lot of people do. It's when the body produces antibodies that attack specifically the glands in the eyes and the mouth, drying them out. And of course, having a dry mouth can lead to dental issues. But it's not really limited to that. It can also produce antibodies that will attack organs and blood vessels as well. And so I've not been diagnosed with this myself, but I do have this problem, and it seems like a diagnosis is right around the corner. Alright, let's move on to Raynaud's phenomenon. When it is tied to lupus, it's called phenomenon, but when it's on its own, it's called disease or syndrome. And this is when the blood vessels, the arteries, are narrowed for usually a short period of time, and it's very often triggered by cold weather. So this is mostly happening in the hands. If you Google Raynaud's, you can see the results of it. The hands, and specifically the fingertips, will turn blue or white. When you have like a Raynaud attack, the blood flow is restricted, sometimes completely, and you'll lose all that sensation in your fingers, and they'll go blue or white. And honestly, the list just goes on and on, to psychosis, to miscarriages, to fibromyalgia. I could go on and on. There are just so many symptoms that people with lupus can suffer. And again, everyone's is different, and some people will have these and some people will not. But the list is quite large, and I'm hoping that perhaps with all of this, you've got a pretty good idea the amount of work that would go into treating so many different symptoms of working with your doctor and tackling each one of these symptoms individually. Because remember, you can't treat lupus itself. There are really no drugs out there that can do that. Now, what does it take to get a diagnosis of lupus? Well, let's start with, on average, it takes nearly 6 years for people with lupus to get a diagnosis, from the point where they first reported the symptoms. And a majority of those people have reported being incorrectly diagnosed during that time. Now, there are a current set of standards for diagnosis. However, they can vary from organization to organization, facility to facility, and whatnot. But this seems to be the most common set of standards. And you're looking for 4 or more of these criteria to be present for diagnosis. And usually you want at least 1 clinical and 1 immunologic criteria. So let's start with the clinical. The first being the malar rash, or the photosensitive rash, or even lesions. I myself have the malar rash and photosensitivity. I do not have lesions though, but they are very common with lupus and probably inevitable in time. Number 2 being the discoid rash. Again, I do not have the discoid rash myself. 3 being oral and nasal ulcers, another symptom I do not have. 4 being hair loss, including facial and body hair. I do not have hair loss myself. I got a nice full head of hair, but I do have a little bit of thinning of hair on the facial front. 5th one being arthritis, joint pain, fingers, wrists, hands, toes, even shoulders. I check out on that as well. The 6th being inflammation in important areas such as the lungs or heart. I have both, and that contributed to my diagnosis. 7th being renal. The kidneys are usually one of the first, if not the first, organs for lupus to attack. Luckily, myself, I have not had any kidney problems as a result of lupus. 8th being neurologic. Things like seizures, psychosis, strokes, and neuropathy. I myself have had neuropathy and a TIA. Again, this has contributed to my diagnosis. And the remaining 3 I have not been diagnosed with. Alright, moving over to the immunologic criteria. A positive anti-nuclear antibody. This is very common in people with lupus, however, it is not necessary. People with lupus have been testing negative for ANA, and in fact, people who've tested positive for anti-nuclear antibodies do not have lupus. This can be caused by many things, anything from a virus to certain drugs can trigger anti-nuclear antibodies. It's just one factor in a diagnosis. However, number 2, the anti-double-stranded DNA is highly diagnostic of lupus. Not everybody with lupus has these, but if you've tested positive for an anti-DS DNA, it is pretty much a guarantee that you'll have a lupus diagnosis. This is an antibody that will attack the DNA itself and destroy it. And I have tested positive for this on every lab that I've done. Of the remaining, I have tested for low levels of the proteins that fight certain infections that get gobbled up by inflammation caused by lupus. So all of these factors, all of these criteria are taken into account for a diagnosis of lupus. And as you can see, I hit on quite a few of those, and that got me my diagnosis. So what's it like living life with all these symptoms, with having one or more, or even all of joint pain, of confusion, of loss of focus, memory loss, chest pain? What is life like having all these things thrown at you constantly? Well, I used to be a morning person. I would hit my alarm. I'd be up in seconds. I'd on my way to the bathroom, getting ready for work. Working 10 to 12 hours per day was common. I could do that no problem. I loved it, even waking up that early in the morning. That is just not possible anymore. It can't be done. I can still wake up early, but I have to take a moment and assess my situation. You know, what hurts today? How bad is the joint pain? Am I afraid that I'm going to tumble over when I get up on my feet? Am I going to be able to withstand the heat of the shower? You know, what are the chores? What are the things I need to get done for the day? How much work am I going to be able to do? I have to take all that into account, and all of it is energy draining, and I have to figure out what am I going to be able to accomplish and what am I not. Am I going to be able to take a shower and work an 8-hour shift and then come home and cook something or clean something? Am I going to be able to do all of that? And every little bit counts, man. We're talking a 5-10 minute shower of hot water. It drains you. It completely drains you. And when we're just talking the basics, you know, basic eating and cooking and cleaning. Then there's relationships, friends and family, even pets, man. You got a little kitten that needs a lot of attention. That's going to drain you. You got to take that into account. How much time are you going to spend on that during the day? How much work are you going to do? How much cleaning are you going to do? Do you have to clean the kitchen? Do you have to clean more than the kitchen? Do you have to clean the bathroom? Do you have to clean the family room? All these things. Do you have to wash the dishes? Do you have to clean floors? Are you going to go out with friends? Are they going to come over to your place or family? Whatever. You have to take all into account, and it's just going to drain you. And if you do it too much, if you spend too much energy on that, you're borrowing against your future self for the next day. If you overdo it, the next day you're done. You are not going to be able to do anything. You have to spend the day to recover and prepare for the next day. That's just the way it works. You have to plan what you're going to do for the day, and you're probably always going to come up short. And you're going to hit a point somewhere, whether it be 10 a.m., 2 p.m., 5 p.m., 8 p.m., you're going to get to a point where you're like, I'm done. I can't do it anymore. I am done for the day, and I got to take the rest of the day off to recharge and prepare for the next day. And all this takes a toll on a person. The pain, the fatigue, the side effects from all the medication that you're pumping into your body, the inability to complete simple everyday tasks, the cognitive dysfunction, the isolation both socially and professionally from people who don't really understand what's going on, the concern about the future, and not just with your health, but financially. In a recent study, I think they calculated the direct and indirect medical costs, and that the cost of your medications and your medical bills combined with the cost of loss of income due to missing work averages about $23,000 per year for people with lupus. And all of this takes a toll and changes who you are. Your mood and your personality completely changes. And if you were to talk to somebody who knew me beforehand, they would tell you that I'm a different person. And in fact, if they knew me very well, they would tell you that I'm a completely different person than what I used to be. Because it all takes a toll and changes who you are. You become depressed. I mean, there's no way you can go through all this without getting depressed. It affects your mood, and it just changes you. Now, I know this video has been going on probably a lot longer than what I intended. If you made it this far, then I thank you for sticking around and listening. The best thing you can do is to educate yourself on what lupus is, and perhaps to share that with people you know, so that people can understand what's going on. It lags far behind other diseases like cancer and Alzheimer's as far as research funding goes. And perhaps that could change one day if people were educated on what exactly lupus is. And as you can probably hear in my voice, I've been recording this for quite a while, and I'm already completely drained of energy, and I know it comes out in my voice. And all my content that I put on my channel too, you can hear sometimes if I've been recording too long, that it's been drained out of me. So I've got to put stuff away, take a break for a day, and then come back guns blazing. If you did last this long, I thank you guys for watching. I really appreciate it, and I hope you take away from this knowing a little bit more about what lupus is and have a better understanding what it is. Links will be in the description down below if you'd like to learn more, and thanks for watching, guys. See ya.